So I just love those because it just smiles all around. So it's great that we get to capture those for history. So our next agenda item is public comment. So two sections. First of all, if there is anyone generally that wishes to make a public comment, now would be the time. But I'm thinking I haven't seen anybody. So otherwise, I have a particular some words to share with you. So in order to commence the collective bargaining process with the San Jose Federation of Teachers, AFT Local 957, for the 2023-24 fiscal year, both management and the bargaining unit need to sunshine or make public their respective proposals. This is done in a one-step process by sunshining the proposal and conducting a public hearing at tonight's board meeting. Tonight, the AFT Local 957 initial proposal to Metro Ed for the 2023-24 school year are presented to the governing board with the recommendation the governing board, one, in terms of approval. So then we will move on in our agenda. We do not have a student report, but we do have a Silicon Valley CTE feature program. So I turn it over to Superintendent Lynch, who looks like he's going to turn it over.
Good evening, Superintendent Lynch and members of the board. It's my pleasure to introduce one of our dental assisting teachers, Ms. Dault. As I got to know Ms. Dault, I think if I were to, the only way I can describe her is very passionate about our profession and the heart of a teacher. So not many teachers can outlast me on campus at the end of the day, but I often see her setting up her classroom for the next day's lesson. That's a rare thing, and I often lecture her on work-life balance. So with that, I'll hand it over to Ms. Dault.
So my name is Suzie Dault. I've been with Metro Ed for 3 years now. And I have to say that I really love working here. I have my own business, Dental Specialties Institute, which I'm going to be retiring from because I love this place so much that I want to retire from here. So I don't know when the time starts where I have to be timed, so I don't want to take up anybody's time.
You're doing fine.
I'm doing good? Okay. When I came here, I was a sub, and I didn't want the job at all because I already had my hands full. And I worked 7 days a week, and I've been in the field since 1983, and I started my company in 1999. And I just love teaching. It's been my passion to help people. It started with people who are on the job who couldn't afford to go to school or couldn't afford to do much of anything, and now have become, professionals in the dental field, a dentist, orthodontist, or, So now that I'm here, and I realized that when they offered me the job, I said, oh God, I don't know if I want this, but then I said, I'm just going to do the interview. And the students, I did the interview, and I thought for sure they're going to say, no, we didn't want it. So when they did come back and offer me the position, I was like, oh my God, now what do I do? What did I get myself into? But it's been a roller coaster, but it's been rewarding, and I'm just blessed to be a part of Metro Ed. And with that said, just want to share a little bit about our dental assisting program we have here. This year, 2023-2024, and the AM class is 28 students, and 20 students in our afternoon class, and we do have a dental assisting program in the evening. Was able to start a pilot class, and it's going, and we have the adults that are in the class, and so we have some that are experienced and some that aren't, and they're just really they're so I can't even say the word for it. They're so passionate, and they get there before I get there, before I open the door, want to get started. We have 63 females in my class, and there's 4 male students, a total of 70 students. The course description here is a comprehensive dental assisting preparation and internship program. The course covers academic theory, hands-on technical skills, and employability practices. Learn chairside assisting, lab practices, X-ray techniques, and opportunity to earn state certification in radiation safety and infection control. This is ideal for aspiring dental assistants, hygienists, dentists. This program paves the way for rewarding high-demand certifications up to 30 high school credits earned upon successful completion. And I have to say that our EVA that I've been working with, or our dental assisting teams working with, are amazing. They want to mentor our students. They do everything they can. They have them come in and shadow, even during the school year. And they end up, donating stuff to us and just giving us good advice to how we can better ourselves as a team in the dental assisting program. The goal of the program is to engage students in the dental field, gaining the necessary skills to move forward, applying to colleges, internship, and entry-level jobs. Students understand the economic value of their skills and talents in post-secondary success through internship. Students' guidance for personal and professional growth is supported through our mentorship. The goal of being a dental assistant with a career ladder mind, multifaceted, initially the role serves as an entry point into the dental health care, offering invaluable clinical and administrative experience. As a dental assistant, you learn the ropes of the patient care, the chairside assistance, to administrative assistance, to scheduling and billing. The foundational knowledge provides the basis for more specialized roles with dental health care. Here, I have to say for our memberships for the educational EVA, they are amazing. And matter of fact, I have to give a shout out and thank you to Dr. Mark Stepovich. His brother also has been on my team teaching an ortho class, and Dr. Mark Stepovich is on the board here with us for educational students. And he donated a panoramic machine, as you see in the corner there. It's over, and brand new, it'd be over $100,000 for that. And it's about less than 10 years old. And he said, I want to donate this in hopes that you can teach the students with a little bit more advanced skills in ortho, cephalographs, panoramics, CT scans, tomography, whatever, so they get more experience and exposure with that. Also, Dental Specialties Institute donated 7 X-ray units there in hopes that maybe someday we'll get a larger laboratory where we can expose the students to more and actually have more flexibility to bring in patients and offer free X-rays, which I have done through the year already with the programs here. Student certification and portfolio. We have Skills USA. I've been involved with that for many years. Tooth morphology is important. They have a project they work on with that and be able to present that to their employer. CPR, X-ray certification, 8-hour infection control is mandatory. The Dental Practice Act is mandatory. That's not offered here, but I give it free to the students enrolled, so they get a certificate for that at no cost. Post-secondary action plan, resume cover, and career-ready portfolio. The oral surgery, I teach this, and I set up for when we have our open house and when we have the teacher meet the teacher. I set it up like a showroom. It takes me hours to do it, but I love it. But I also want the students to be more involved in specialties like oral surgery. So we have the mannequins there where they learn about pulse oximetry and all the oral surgery instruments and how to pass it in stand-up dentistry or reading the pulse oximeter screens and knowing their oxygen saturation. So they learn to set that up. They learn endodontics is the next, is a root canal, which he is specializing in. He's one of my students from last year, Christian, and so he works for an endodontist now. Composite and amalgam restoration, knowing the difference between a plastic and a metal restoration. So we have these setups that they have to memorize and to be able to go in the field and actually know what they're doing. Also, I have a setup for anesthesia. On the right-hand side, they learn how all the different kinds of medications and anesthesia that may cause a problem with the patient if they had high blood pressure or heart concerns. So they go over the anesthetic and set it up in hopes that the doctor trusts them that they don't have a medical emergency. Also, with all the instruments on the left, you see that we have trace setups there. The next slide here shows that what I do is I challenge the students. I take every one of those setups, amalgam, composite, and crown and bridge. They're all on trays, separate trays, have to memorize. I put them in dump every single one of the instruments in one bin, and they have 2 minutes to put them in their exact working order as they use them. And the student that I have on the next slide, he did it in 1 minute and 45 seconds. So he knew his instruments. And I was so impressed. Remember that day?
Oh yeah.
It was crazy. So they don't get checked off until they've actually done that. So then this way I know they know what they've learned. The next class, this was my last year's class, and so we really get as the 8-hour infection control became a requirement in 2010 at the dental board. And students can't start their job 120 days of employment within the first year. They must have that. So the school here offers that, and we're very serious about the infection control of harming any patients or cross-contaminating. So we have a lot of fun in the class putting on all our PPE. This is my class now. The evening class is above on the left, and my PM class and my evening class. And I'm really excited to be able to be a part of developing that evening program. Infection control, so they learn all the, sterilization, wearing uncomfortable PPE and utility gloves, and understanding how important it is to make sure that things are sterilized properly. It's not just to put them in and get them through, but it's also a safety hazard that we want to make sure we prevent the public at large. I also share with them in the beginning of the course that how well do you wash your hands. So I have a germ lotion. I think it's lotion, but it's not. And so that I put a black light, and you can see all the areas around the fingernails that they've missed and that are not clean. So then you'll see that they start washing their hands a lot more in class. In the class, I tell them how important it is to be a team player. We're all a team together. I'm together. We're a team. If we want to be successful. So if you have groups, then you would make 4 groups that I have. You have to be a survivor. And one's failing in your class, you all fell in that group. So you have to help each other. And it's worked out really well with them actually studying with them and tutoring them and helping them learn. As you can see on the right-hand side, they work together as a team to learn how to do the procedures. On the next slide also is chairside instrument passing. They learn how to pass instruments, not just throw them or whatever, but learning to use every single one of their fingers and pass and be able to not drop them on the patient. Sorry. And the next one's lab skills, where we learn how to take impressions. We have them take impressions on a typodont, that they take impressions on each other, and they learn what it feels like. And then after they're done doing the impressions, they have to go ahead and then pour them up. On the right-hand side is an impression that they did is they see the buccal buccal fold, they see all the details. You pour it up, and this is what the doctor wants to see, is the detail. Then the clinical skills is when they start working on clinical patients. As you see, Christian's in the chair as a patient. He loved that one because what I do as far as aspirating, they need to learn how to aspirate. It's not just spraying water and suctioning. I bring in a whole case from Costco of Oreo cookies, and they think it's a treat. So I say, no, you can chew it up, you can't swallow it or eat it. What we're going to do is you chew it up, you're going to make it a mess, take your tongue, pull it all over the place, then you have to aspirate. So being able to see what's in the mouth and spray and move it and suction.
The visual I'm getting right now. Keep going.
That has built their skills as I have no idea. So there's Christian again at work at his internship. I'm so proud of him. He wanted to give up during the partial way, and I had a heart-to-heart with him and told him that he had to believe in himself. He wanted to be an oral surgeon. That's still his goal. He stuck it out, and I watched him in action and almost made me cry. So he's there again, working with his doctor in the internship and just acting like he really did well. He was a hot shot. I have a couple other students. Stephanie was working at Oak Ridge Mall, and she was doing hers. You can see her standing there. She's participating in six-handed dentistry. And then Brisa is another student, and we can just pass through the rest. But as far as all the leaders' opportunity, we have all these acronyms as far as they want to grow to be a dental assistant. We want them to be a registered dental assistant, extended functions, an ortho assistant, lab technician, hygienist, and it goes on. The list goes on and on and on. But I have a few more. Should I stop?
Good. You want to go ahead?
I just got a couple more.
Yeah, please. You did the work, please.
So the program for the evening class is we'll be offering corona polishing and Pitt & Fisher sealants, and that's an advanced class, and law and ethics as well. What I did for the whole school and the students, when I started here, they couldn't find patients, and they were supposed to find their own patients for x-rays. So I had them go around and say, if you want your patients, you got to be motivated. They went to every single classroom, and they introduced themselves and shared the class, and they were able to recruit patients at no cost to be able to complete the requirements for the state to get their x-ray license. The cost of the x-ray is $150 to $200 for a full set of x-rays, which they would then take to the dental office, and they'd be able to have them read and be diagnostic. The next, there's two more pages next. You'll see Isabella. That was Crystal. Isabella, she has taken my class, and she asked me for a letter of recommendation. I'm so proud of her. I wrote her letter of recommendation. She did her internship with a friend of mine, and she got accepted at UOP Dental School for dentistry.
Congratulations.
I'm proud of her. Also, the oral hygiene workshop I did for all the classes. I had them come to my classroom or went to their classroom, and we had them, we can go through those quickly, you'll see, learning how to brush and floss their teeth, and showing how they don't brush. So it was a big deal. They ended up with a new toothbrush, floss, and other objects that they can use to floss threaders and stuff like that. So you can see that as they smile for me, all the purple means that they have lots of plaque in their mouth.
Right.
And,
That is good, I guess?
yeah, it's
Okay.
not actually.
Oh, no. It's just purple. I didn't know.
Yeah, so we'll keep going to the one that gets better.
Oh. I want to see the Oreo cookie, but keep going.
Confidential.
Yeah. So, so this one does not brush your teeth at all. So she learned how to brush good. Here I offer a forensics class, and I offered it to all of the instructors that were here at free. A lot of my students went to for free. I have a person that comes out every year. She's in forensics and works for the FBI and the wards. And so they get a real person who's missing, and they get to put their face together, how they think that they looked on a clay model with a skull, and then they have to tell us about what they learned about the patient and if they were found. One of the classes, one person was found, but they weren't. Right. So these are our staff members down there, and there's a whole bunch of my students that came and were able to participate. So April, I did the April May was oral hygiene, and Foothill College we did the field trip tour. We had guest speakers, workshop for the forensics, and then in October we'll have another field trip, hoping to California Dental Arts to learn how to do crowns and bridges, how it's made, how do they make them. And last one is the salaries. I did some research on the salaries for August of 2023. The average pay for a dental assistant, this is in the state of California, was $20.08 an hour. Salaries as high as $27.18, as low as $12.22. The majority of dental assistant salaries currently range between $16.97, the 25th percentile, to $21.95 to 75th percentile in California. The average pay for range for a dental assistant varies as much as $4.95, which suggests that many more opportunities for advancement and increase in base in the skill level, location, and year of experience. So right now, the state of California is low on hiring, but in San Jose, I did a evaluation that the average dental assistant salary in San Jose, California is $40,411 a year and $19.93 an hour. The entry level for a dental assistant is $28,000 yearly, and so the average dental assistant salary in San Jose is $40,411. The dental assistant salary range between $28,000 and $56,000 a year. This San Jose base salary compares to the United States average dental assistant salary, $40,411. The average hourly rate for dental assistant in San Jose, $19.43 an hour. I'm sorry I went over, but it's the first time I've done this.
Thank you so much. I absolutely love. I've had the pleasure and privilege of coming in your classroom on tours. I don't know how many times now, and I just absolutely love seeing the engagement and the focus, and they are totally into it. My only question is, when do you sleep? But you don't have to answer that.
Okay.
Holly, anything?
I just want to attest that we don't have dentists in North San Jose, and I've gotten to have 2 dental assistants from Metro Ed who've been part of that, who've been working there. So they did a great job, and I still got my teeth.
Thank you so much. I appreciate you guys.
Do we have a movie of this presentation here tonight? Do we have her voice recorded anywhere?
So, if you all saw us over here looking at our phones,
So
we
the
weren't
phone.
checking any game scores.
Okay.
The amazing Amanda and Shannon are live streaming on our social media right now, so
Okay.
we'll happily send you the links so you
Yeah,
have it in
yeah.
the future. It's on YouTube.
Fantastic, because, I mean, this, I'm sold. I don't particularly like looking at people's mouths, so I'm ready to come to your class and pick up an instrument that I sort.
At least an Oreo cookie, right?
I did visit your class once, and I heard 2 girls talking, and I just heard a little snippet, and it's just so impressive to hear kids helping other kids. And she was saying, I think you'll find if you hold your wrist at this angle that you'll have a better angle on the tooth. And the concentration that they had, and how careful they were being, and how, I don't know, it's impressive to see. But this was way more than I thought you did. There's a whole lot more going on here than I ever thought. And I'm afraid what my little plaque purple thing would show. I'm going to all scrub up. Okay, thank you.
I have a student, if we have time for him to speak for a few minutes.
Oh, please.
Christian.
Oh, man, all right. What, are we going to say no? Come on, sir.
Testing. Oh, wow. Okay, cool. So I wanted to be a dental assistant since I was about like 16, probably a bit longer. And I'm from a small town, it's small-ish, and there's not a lot of opportunities outside of maybe joining the military. So coming out here, just coming out to San Jose was like a big leap for me. So I was a bit nervous, a little bit shell-shocked at first, but once I got more accumulated, things started to come a bit easier. But when I started the dental course, I was like, oh, snap, this is actually happening. Well, like, you could say that you're going to start something new, but if you don't actually go and do it, then you haven't really done anything. So actually having my toes in the water and being around some other people who are also just as eager, if not even more driven, to learn about this thing that I was passionate about, made me a little more excited. And then towards the middle of the internship, there was a bit where she had mentioned where I thought about quitting. I was going through a lot of negativity in my life, and I had to think to myself whether or not I was even going to be good enough at doing this. There were some attributes that I lacked that I saw other people had, and I thought that it would be a detriment to my career. And after talking to Ms. Dault, I didn't decide to follow through on quitting because, in all honesty, that's just, you don't gain anything from leaving.
Start what you finish.
Exactly. You keep
Finish
on.
what you started.
Exactly. Yeah. So I kept on going, and I'm here now. I'm working at Endodontist Clinic. I have great days over there. I love my coworkers. I learned so much from Miss Dault, be it as just dental or just philosophically, I guess. There's a lot to offer from this class, and if by chance any other possible future dental assistants are watching this live broadcast, I'd advise that you go through with it and try your best. See if you like it. When I started, there was a bunch of students, and then it started to dwindle down through. But overall, the people who were passionate, the people who it really grabbed, they're still doing it. They're still, like, if you really want to do it, you can do it. And Ms. Dault gives a great support system to help you reach out, push forward, and try to do what you need to do to get what you need to get done. She has stayed up outside in her classroom so many times, more times than she really needed to. There was a couple times, I'm pretty sure she was barely awake. I'm thinking, how is she doing it? I'm not going to ask any questions. I got to study for this test.
Yeah.
You know, hard work gets rewarded. And just look at her. She's eager. She's eager to teach. If you're eager to learn, I learned a lot from her. I'm very grateful.
Thank you. You're both going viral, just so you know.
I can tell you this, if you're sitting in your chair about to get a root canal, especially if it's your first root canal at 8, you need a happy, comforting face, and you've got it.
Oh, gee,
So skills are one thing, that's paramount, but it sure doesn't hurt to have somebody in the room that makes you kind of feel a little better.
Well, thanks, man.
Here, here. Thank you both. Wonderful presentation.